time now for our weekend cover story. Rapid hair loss, shortness of breath and the feeling of the body shutting down. They're all symptoms to be taken very seriously. But for Andi Lew, getting to the bottom of her suffering was just the beginning.
That's right. Adelaide-based Dr Tania Ash diagnosed her with a life-threatening condition called breast implant illness, or BII. Andi's implants had actually ruptured and were leaking into her body, causing her organs to slowly shut down.
6 different surgeons and quotes of thousands of dollars later, finally a solution. After an explant surgery 5 weeks ago, Andi is finally on the mend. And she joins us now, along with Dr Tania Ash in Adelaide, to discuss all of this. Good morning to you both.
Good morning. Yay, I'm free to be me.
Well, just talk us through those symptoms, Andi. What were you starting to feel and how long had you had the implants?
Yeah, absolute confusion and lethargy and brain fog, like a tinnitus covering the whole brain. You know, you've got everything shutting down, like the digestive system starts to shut down because the body wants to kind of detox through your natural detoxification pathways. I wasn't sweating for a whole year. I knew that I had insatiable thirst, yet nothing was coming out. And that's because, you know, the gallbladder, the liver, the kidney, all these organs that are responsible for detoxing weren't working. And so my digestive system started shutting down too. I wasn't even going to the bathroom for 5 days and it was just getting crazy. But they're out of me here.
That's in there.
Yep, there was an undetected rupture. When I met Dr Tania, you know, we've been practicing for decades, cross-referring patients and wellness coaching clients, but about 2 years ago, she consulted and diagnosed me with BII, and it was then that I realised, uh-oh, I had to join the dots.
So, Andi, how much sort of anxiety was there in actually finding a surgeon to remove the implants? Because I understand that's, you know, there's been roadblocks there too.
Exactly, and as a wellness expert, I would never advocate augmentation because I know that the body wants to expel a toxic foreign object through the body, but I had a very strong psychological reason, and all of us women do. It's really important to start to forgive yourself and get ready to remove because there aren't enough trained surgeons to do this specialist surgery, which is called en bloc or complete capsulectomy. The body starts to surround, you know, the capsule with a scar tissue, and I guess it's an innate intelligence response so that it doesn't spill out into the rest of the system. But these surgeons are removing the scar tissue with the bag, so in my case, at least it didn't continue to spill out.
Let's get to you, Dr Tania. How were you able to recognise what was wrong with Andi when all these other doctors weren't?
Well, to give you context on Andi's case, I've been a doctor for 30 years and an integrative doctor for the past 20 years, where we're trained to go to the root causes of patients' health symptoms and very much pull the picture together. We're really the house doctors of medicine. So Andi presented to me with this smorgasbord of what we call mast cell activation or BII symptoms, which can affect any system in the body. And BII MCAS has also been my own personal health journey, so it's very front of mind for me. So looking at Andi's systemic symptoms in conjunction with her localised left breast pain, which turned out to be the point of the undetected rupture, we were able to connect the dots in Andi's case and make the diagnosis, which did come as a shock, but which Andi has courageously embraced and is on her health recovery now.
Doctor, and that is great to see. Have you seen an increase in patients in Australia seeking this kind of surgery?
Absolutely. I've seen a significant uptick in en bloc and complete capsulectomy explanting. All of my patients who have explanted have either had a complete resolution of their MCAS BII symptoms or a vast improvement with detox support. I'm also seeing the procedure being used preventatively, more in cases of patients who've had their textured implants recalled by the manufacturer, and also some breast cancer survivors who've already been through the trauma of their diagnosis and double mastectomy and don't want to be facing another risk of capsular cancer, breast cancer.
Andi, what would you say to any other women who have concerns about their implants?
Well, they're not going crazy. There's a subculture of women online in support groups. There's, you know, class actions brewing, and it's really important to know that they're not alone. Tune into our podcast. I've got a podcast where I, you know, interviewed Dr Tania about everything from detox protocols to finding the right surgeon and accessing your superannuation on compassionate grounds, which is for a life-threatening illness, because that's what it is. So well-to-do is the name of the podcast.
You feel good? Okay. You feel good now? You look great?
Feel amazing. The inflammation went down instantly. And I guess that's what people can't believe, is that it doesn't have to be scary and you can look amazing. You don't need a fat transfer or a lollipop lift necessarily.
Okay, great.
Andi Lew, thank you so much.
Thank
Doctor,
you.
thanks to you also.